Assalamu alaikum, this is Sister Zainab, and today I'm talking to you a little bit about the state of the health sector in Gaza. I'm going to start, you probably are aware of some of these data, but I'm just going to start with the fact that more than 1,000 health sector workers have been killed, deliberately targeted in Gaza. We know that most of the medical facilities are out of service. We know that in many cases the civil defense teams haven't been able to operate, for example, retrieve people from under the rubble. We know, for example, that we have particular needs. We know that only the life-saving operations and services are able to be given at the moment, so that we know that there are every day we have several, I think it's up to 10 children needing amputations. So this is a huge impact, and you can imagine, so on the one hand I'm saying that many GPs, many healthcare sector workers have been killed. We know that there is not really a functioning health care sector anymore. Now, before the genocide started, obviously Gaza was already under occupation, basically blockaded. It was under siege. But the healthcare sector was functioning. So it did obviously have clinics, it had a good number of hospitals, and even non-life-threatening procedures were offered as a matter of routine. So you can imagine at the moment we're dealing with life-threatening injuries due to people being pulled out from rubble, having lost limbs, life-threatening burns. All this is given priority, and of course you've seen the photos in the media. Now, we do have other things such as people who have heart disease, diabetes, who need dialysis. All these things cannot be provided at the moment. So what can I say? So whatever fatalities we have observed to date, because the healthcare sector has been devastated, these things are going to actually become even worse, because we have an accumulation of people requiring routine services. For example, eye care treatments are not being given. There's stories of people receiving burns or injuries to their eyes. Now, if medication were available, if simple eye procedures were able to be given, their eyesight could be saved, but in many cases they're actually becoming blind. For example, mothers trying to look after their children, they're losing their eyesight because these services aren't available at the moment. So this is just a few points on the healthcare sector, and we know that it's devastated, and just follow up, read up for yourself and look at the statistics. I haven't been able to list all of them for you, of course. And this is Sister Zainab with you for today. And goodbye.